What if I told you that the reason you drift when you walk, that invisible hand pulling you toward the edge of the hallway, that moment of hesitation before your brain can convince your body what straight ahead actually looks like, has nothing to do with your legs, your knees, or even simple muscle weakness? What if I told you the real culprit is a complex neurological phenomenon involving three distinct systems in your body that are silently failing you right now, in a way that standard blood tests, MRIs, and physical exams completely miss? This is what I see in my clinic, day after day, after 2 decades specializing in geriatric neuroscience and functional longevity. My name is Dr. Liam Cooper, and over the past 20 years, I've worked with thousands of patients who thought their unsteady steps were just an inevitable symptom of aging. They've been told, watch your step, hold the railing. It's just age. They feel invisible and unheard because nobody has actually explained the complex science behind why their body is doing this. But here's the problem with that. It's just age diagnosis. It's often dead wrong. Drifting, wobbling, and uncertainty aren't just symptoms of getting old. They are clinical signs of 3 vital systems falling out of sync. Today, we are pulling back the curtain on the real science of gait instability after 70. We are moving beyond the generic advice and doing a deep dive into the specific mechanisms that cause the 70s drift. We'll talk about structural compromises in your spine you've never heard of, a hidden form of arterial compression in your neck, and a reset technique for your internal GPS that most doctors simply don't have the time to explain. We're not just talking about exercises. We are going to build a new neurological pathway from the ground up. If you are tired of living on uncertain ground, you need to understand exactly what is happening inside your body. Let's begin by deconstructing the silent failure of your body-brain loop. Here is the truth that most conventional medical visits fail to uncover. Your ability to walk in a perfectly straight line is not a mechanical function of your muscles, but a high-speed computational feat. Every single time your heel strikes the ground, your brain must process thousands of data points per millisecond. This is what we call the Neuro-Gait loop, a continuous 3-way conversation between your visual system, your vestibular system in the inner ear, and your proprioceptive network, the millions of microscopic spatial sensors embedded in your joints and tendons. When you cross the threshold of age 70, this loop faces a dramatic, silent crisis. Clinical data shows that the transmission speed of your peripheral nerves, the actual velocity at which signals travel from your feet up to your spinal cord, drops by up to 15% to 20%. This is not just a statistical decline. It is a profound communication lag. Imagine trying to steer a vehicle where the front wheels only respond a quarter second after you turn the steering wheel. Your nervous system is forced to operate with that exact same latency with every single step you take. Because the signals from the soles of your feet arrive late, your brain is essentially guessing where your body is in space based on outdated information. To compensate for this terrifying micro-delay, your central nervous system initiates a protective mechanism known as gait widening. You begin to shuffle, your stride length shortens, and your body naturally drifts toward one side because it is desperately searching for physical markers like walls or furniture to verify its position. But the degeneration goes deeper than just signal speed. Inside the spinal cord, a process called age-related myelin degradation takes place. Myelin is the protective, fatty sheath that insulates your nerves and allows electrical impulses to travel cleanly. As this insulation thins out in your 70s, the spatial data traveling up your spinal column suffers from signal bleed or neurological static. The data arriving at your brain's primary balance center is no longer a clear, crisp map. It is a distorted, fuzzy picture. This is precisely why traditional leg strengthening exercises like leg extensions or calf raises yield such disappointing results for gait drift. You are trying to upgrade the mechanical pistons of a car when the entire onboard computer system has a corrupted wiring harness. If the brain receives corrupted data, it outputs an uncoordinated drifting step, no matter how strong your thighs are. To reverse the 70s drift, we have to look past the muscles and target the structural pathways that keep these lines of communication open. In the next section, we are going to expose a hidden anatomical bottleneck occurring right now inside your neck, a mechanical restriction that is quietly starving your brain's balance center of the vital blood flow it requires to keep you walking straight. To understand why your body drifts, we have to look directly at the anatomical crossroads where your neck meets the base of your skull. Inside your body, you have two major vertebral arteries that branch off near your collarbones and travel straight up toward your brain. Here is the architectural flaw in the human body. These crucial blood vessels do not run through open flesh. Instead, they are threaded precisely through microscopic holes in the outer wings of your cervical vertebrae, winding through the bone like a thread through a needle. Once these arteries exit the very top vertebrae, they merge to form the basilar artery, which supplies the exclusive, non-negotiable blood flow to your cerebellum, the brain's master balance computer. Under ideal conditions, this pipeline delivers a continuous, highly pressurized stream of oxygen and glucose. But as you pass age 70, a destructive physical change occurs. Decades of forward head posture, microscopic scar tissue from old injuries, and age-related disc thinning begin to compress this delicate passage. When your neck muscles, particularly the suboccipital muscles at the base of your skull, become chronically tight, they undergo a process called myofascial fibrosis. The muscle tissue loses its elasticity and hardens into dense, tight bands. This tight tissue places continuous mechanical pressure directly onto the vertebral arteries. In the medical community, we refer to the resulting state as intermittent vertebrobasilar insufficiency. This is not a major catastrophic blockage that causes a sudden stroke. Rather, it is a microvascular bottleneck. Every time you turn your head to look at a shelf, pivot in your kitchen, or simply look up at the sky, this muscular tension pinches the vertebral pipeline even further. This mechanical pinching creates a sudden, transient drop in the blood volume reaching your cerebellum. Deprived of its optimal energy supply, your balance computer experiences a microsecond operational lag. Because the cerebellum is running on a reduced energy budget, it can no longer process spatial data at full capacity. It fails to calculate the tiny, subconscious muscle corrections in your ankles and hips that keep you tracking in a straight line. The result? You experience that sudden, terrifying drift to one side, or that brief moment of total hesitation when you stand up from a chair and wait for your surroundings to stabilize. Furthermore, this neck stiffness corrupts your cervical proprioceptors, the dense network of positional sensors located inside your upper neck joints. Your brain relies on these sensors to know exactly where your head sits, relative to your shoulders. When these sensors are crushed by chronic muscular tension, they begin sending frantic, corrupted positional data to your brainstem. This creates a severe sensory mismatch. Your eyes say you are walking straight, your inner ears say you are upright, but your neck is screaming that you are tilted. Your brain tries to resolve this internal argument by pulling your body to one side, forcing you to reach for walls just to feel secure, while the cervical bottleneck starves your balance computer of vital blood flow. An equally critical degradation is occurring at the cellular level inside the brain itself. Deep within the posterior fossa of your skull lies the cerebellum, a structure containing more than half of all the neurons in your entire central nervous system. This highly organized neurological grid is the master processor responsible for sensory integration, the ability to take visual, inner ear, and tactile data and instantly translate it into smooth motor output. As we cross into our 70s, the cerebellum undergoes a highly specific form of age-related structural atrophy. Neurological studies demonstrate that the master cells of this region, known as Purkinje cells, decline at a progressive rate during this decade of life. Purkinje cells are the large, intricately branched neurons that form the sole output pathway from the cerebellar cortex. They act as the primary inhibitory gates of the motor system, smoothing out what would otherwise be jerky, erratic muscle movements. When you lose a significant percentage of these master coordinating cells, your brain's internal calibration system begins to drift out of alignment. This cellular thinning creates a phenomenon known as increased postural sway. Under normal circumstances, your body corrects for tiny natural deviations from center completely unconsciously. But with a degraded cerebellar grid, these corrections arrive late and with excessive force. Instead of a microscopic, imperceptible adjustment at the ankle, your brain commands a sudden, visible overcorrection. This is the precise reason you find yourself veering violently toward one side of a hallway, or overstepping when you try to navigate an unexpected change in your path. This cerebellar volume loss also ravages your ability to perform dual-task motor processing. In your 40s and 50s, You could effortlessly walk in a straight line while holding a conversation, recalling a grocery list, or looking at a passing car. This is because your cerebellum had the computational reserve to handle both physical balance and cognitive tracking simultaneously. After age 70, that reserve is severely compromised. When you attempt to walk while mentally processing another thought, your prefrontal cortex is forced to step in and assist the struggling cerebellum. Because the brain is reallocating its limited processing power to help you think, it pulls resources away from keeping you upright. The moment your attention shifts, even for a split second to look at a light switch or answer a question, the physical balance program fails. Your gait immediately destabilizes, your stride freezes, and your body drifts toward the nearest surface for physical reassurance. To reverse this, we cannot rely on standard physical therapy. We must use targeted neurological challenges that force these remaining Purkinje cells to fire, wire, and rebuild their connections. Beyond the brain and the nerves lies a deep structural crisis occurring within the skeletal muscles themselves, driven by a phenomenon known as skeletal muscle asymmetry and localized anabolic resistance. As you age past 70, your body's ability to utilize dietary protein to repair and maintain muscle tissue drops sharply. This means that even if you maintain an active lifestyle, certain high-threshold motor units within your primary gait stabilizers are quietly shutting down. When muscle loss occurs, it does not happen evenly across your entire body. It targets very specific, critical stabilizers first. The absolute linchpin of lateral walking stability is a deep muscle on the side of your hip called the gluteus medius. Its primary job is to hold your pelvis perfectly level every time you lift one foot off the ground. In your 70s, asymmetric atrophy often strikes one side of the pelvic basket much harder than the other, usually due to old, forgotten minor injuries, localized joint wear, or a dominant leg preference. When one gluteus medius drops below a critical strength threshold, a biomechanical failure occurs during every single step. Every time you step onto that weaker leg, your opposite hip drops slightly. In biomechanics, this is known as a Trendelenburg gait deviation. Because your pelvis is unlevel, your center of gravity instantly shifts off-center. To keep from falling over, your nervous system forces your upper body to lean heavily over the weak hip, or it causes you to veer and drift continuously toward that side. This is why you can feel completely steady standing still on 2 feet, yet find yourself drifting to the left or right the moment you are in motion. This muscle imbalance is further compounded by a hidden structural bottleneck in the lower leg involving the tibialis anterior, the muscle running down the front of your shin responsible for lifting your toes. As the fast-twitch muscle fibers within the shin decay, seniors experience a micro-failure called subclinical foot drop. You may not notice your foot dragging completely, but the front of your foot clears the ground by only millimeters instead of centimeters. To prevent your toes from catching on a rug or a threshold, your brain unconsciously alters your entire walking path. It forces you to swing your legs slightly outward or shortens your stride entirely. This asymmetrical pattern creates a twisting force through your lower back and pelvis, which feeds back into the compressed spinal nerve roots. You are left with an inherently unstable, zigzagging walking pattern that drains your physical energy and leaves you entirely dependent on visual cues or physical handholds just to stay on a straight path. While muscular structural failures pull your gait offline from below, the single most powerful disruptor of straight walking after 70 often acts entirely from within the skull. This is the progressive, unmapped degeneration of your vestibular network, the delicate fluid-filled semicircular canals tucked deep inside your inner ear. This organ serves as your body's internal mechanical gyroscope. It tracks the velocity, rotation, and exact position of your head relative to the earth. When functioning optimally, this microscopic system continuously coordinates with your eye muscles via a vital neurological mechanism called the vestibulo-ocular reflex. This internal tracking network allows your eyes to lock onto a fixed spatial target while your body stays in motion. If you turn your head to the left, this reflex instantly moves your eyes an equal distance to the right, stabilizing your visual landscape. Without this system, your vision would bounce and blur like a shaky handheld camera with every single step you take. As we progress through our 70s, clinical research confirms that up to 40% of the sensory hair cells lining these internal fluid pathways naturally wither and degenerate. Furthermore, the specialized fluid inside these canals, the endolymph, thickens and experiences a slower response rate. When this occurs, your internal gyroscope slips out of calibration, often severely affecting one ear more than the other. This asymmetrical breakdown creates a state of continuous vestibular mismatch. If your left inner ear sends weaker spatial signals than your right ear, your brain interprets this data gap as an emergency. It concludes that your entire body is falling or tilting toward the right, even when you are standing on a perfectly level floor. To counter this false internal reading, your motor cortex commands an immediate, involuntary overcorrection. It pulls your physical frame toward the left to balance the imaginary tilt. This is the exact underlying mechanism behind the persistent drift that leaves you veering toward a single side of a hallway or causes you to inexplicably clip your shoulder on door frames as you try to walk through them. This sensory decay manifests most aggressively as a phenomenon I call slip sinking. This is that sudden feeling that the floor beneath you has dropped or shifted, particularly when you navigate poorly lit environments or walk on uneven outdoor paths. Because your visual tracking network can no longer rely on the degraded hair cells of the inner ear, your balance is entirely dependent on your eyes to verify what is flat. The moment the lights go down, or you step onto a plush carpet or grass, your brain loses its visual and tactile crutches. Left to rely solely on a malfunctioning gyroscope, your gait completely destabilizes. Your nervous system is plunged into extreme spatial hesitation, triggering an immediate freeze response, a heavy shuffle, and a desperate, frantic reach for any nearby wall or steady countertop to stay upright. To systematically dismantle the 70s drift, we cannot rely on standard low-intensity calf stretches or generic balance boards. We must target the precise neurological bottlenecks we have uncovered. The correction protocol requires a dual-phase approach. First, we mechanically unclamp the cervical blood supply to the cerebellum. Second, we force the remaining Purkinje cells and inner ear hair cells to hypersynchronize through sensory deprivation and processing challenges. The first priority is resolving the vascular restriction. We deploy the suboccipital decompression maneuver. Sit tall with your spine fully supported. Tuck your chin slightly to create a subtle double chin, which structurally opens the space between the base of your skull and your first cervical vertebra. Place the pads of your fingers directly into the soft tissue just beneath the bony ridge at the back of your skull. Apply a firm, forward and upward pressure, holding the tissue anchored for a full 45 seconds. This prolonged ischemic compression triggers a neural reflex that forces the tight myofascial bands to instantly release their grip. By lifting this muscular clamp, you restore the natural high-pressure blood flow through the vertebral arteries, instantly fueling the cerebellum with the oxygen and glucose it requires to process balance data. Once the pipeline is open, we must immediately retrain the brain to use this restored information through vestibular gaze calibration. If your inner ear gyroscope is degraded, we must use your eyes to force a recalibration. Sit safely in a chair and hold your thumb at arm's length right in front of your eyes. Lock your gaze onto your thumbnail. Keeping your eyes absolutely glued to that single spot, slowly rotate your head 20 degrees to the left, then 20 degrees to the right, moving back and forth at a steady rhythm for 60 seconds. This action forces the brainstem to actively recalibrate the vestibulo-ocular reflex. If you experience a slight wave of unsteadiness during this movement, do not panic. That brief disorientation is the clinical sign that your cerebellum is actively rewriting its balancing software and adapting to the sensory input. Finally, we address the peripheral lag in your feet using proprioceptive surface mismatch training. To force your nervous system to bypass thinned-out nerve sheaths and slow signal speeds, we must strip away the predictable environment of smooth, flat floors. Take a thick plush bath towel and fold it in half on a hard floor, placing it right next to a sturdy countertop for absolute safety. Step onto the towel barefoot. The squishy, unsupportive surface creates immediate spatial confusion for your feet. Stand completely still on the towel for 30 seconds with your eyes open, feeling the tiny, rapid micro-adjustments firing in your ankles. Once you feel completely secure, close your eyes for just 10 to 15 seconds. By closing your eyes, you deliberately cut off your visual crutch. Your brain is plunged into a state where it is forced to scream down the nerve pathways to your feet, waking up the dormant mechanoreceptors to keep you upright. This intense multi-system stimulation forces the central nervous system to establish faster, cleaner backup pathways, giving you the real-world coordination needed to step off a curb, navigate a dark room, and walk completely straight without ever needing a wall. Reversing the 70s. Drift is not about fighting your age. It is about giving your body the exact neurological input it has been starving for. The drifting, the wobbling, and the reaching for walls are simply your brain trying to navigate with a corrupted map. By opening up the blood supply through your neck, recalibrating your inner ear gyroscope, and sharpening the sensory signals from your feet, you teach your central nervous system how to trust the ground again. Consistency is your absolute superpower here. Your nervous system does not rewrite its software during long, exhausting workouts once a week. It adapts through short, precise daily challenges. Spend just 5 minutes every morning releasing your neck and another 5 minutes challenging your balance near a sturdy countertop during the day. Within 6 to 8 weeks of steady practice, the neural pathways will strengthen, old signals will reawaken, and you will find yourself walking across a room without ever thinking about the nearest wall. Please remember that the clinical insights and advanced neurological concepts shared throughout this video series are for educational and informational purposes only. This information should not be taken as direct medical advice, diagnosis, or treatment. Every individual body is unique, and it is absolutely essential that you consult with your physician or a licensed physical therapist before beginning any new exercise protocol, especially if you have a history of severe dizziness, cervical instability, or underlying vascular conditions. My name is Dr. Liam Cooper. Thank you so much for investing this time in your health and longevity today. If this deep dive helped you understand your body in a whole new way, please take 1 second to hit that subscribe button, give this video a like, and drop a comment below to let me know you are here. Share this video with someone you love who deserves to walk with confidence again. Take care of yourself, stay steady, and I will see you in the next video.